Welcome back to our video today on 14 effective ways to lower blood pressure naturally without medicine. High blood pressure, or hypertension, rarely has noticeable symptoms. It affects 1 in 3 people in the United States, 1 in 4 people in UK, and 1 billion people worldwide. The only way to find out if your blood pressure is high is to have your blood pressure checked. As a general guide, ideal blood pressure is usually considered to be between 90/60 millimeters of mercury and 120/80 millimeters of mercury. Blood pressure readings from 121/81 millimeters of mercury to 139/89 millimeters of mercury could mean you're at risk of developing high blood pressure if you do not take steps to keep your blood pressure under control. If your blood pressure is too high, it puts extra strain on your blood vessels, heart, and other organs, such as the brain, kidneys, and eyes. Persistent high blood pressure can increase your risk of a number of serious and potentially life-threatening health conditions, such as strokes and heart attack. Medications can help lower blood pressure, but many natural ways can help without side effects. In today's video, we are going to share with you 14 effective ways to lower your blood pressure naturally without medicine. As always, this video is for educational and informational purposes only, and is no substitute for professional medical advice, diagnosis, or treatment. So do speak to your doctor for a medical diagnosis if you have any health concerns. If you find the content helpful, like and share it with your loved ones to protect their health. And remember to click the subscribe button and hit the bell to stay updated on new videos. Let's start with tip number 1. Walk and exercise regularly. Exercise is one of the best things you can do to lower high blood pressure. Regular exercise helps make your heart stronger and more efficient at pumping blood, which lowers the pressure in your arteries. In fact, getting 150 minutes of moderate exercise per week, such as walking, or 75 minutes of vigorous exercise, such as running, can help lower blood pressure and improve heart health. Additionally, some research suggests doing more exercise than this reduces your blood pressure even further. Tip number 2. Reduce your salt intake. Eating too much salt is the single biggest cause of high blood pressure. The more salt you eat, the higher your blood pressure will be. If you already have high blood pressure, too much salt will raise it further, and may mean that any blood pressure medicines you're taking don't work as well as they should. Cutting down on salt is one of the simplest ways to lower your blood pressure, and will start to make a difference very quickly, even within weeks. Eating too much salt can also lead to all the health problems high blood pressure causes, including heart disease, stroke, kidney disease, and some types of dementia. Because salt is often hidden in the foods we buy, it can be hard to know how much you're eating or how to cut back. So swap out processed foods with fresh ingredients and try seasoning with herbs and spices rather than salt. Tip number 3. Eat more potassium-rich foods. Potassium is an important mineral that helps your body get rid of sodium and eases pressure on your blood vessels. Modern diets have increased most people's sodium intake while decreasing potassium intake. To get a better balance of potassium to sodium in your diet, focus on eating fewer processed foods and more fresh, whole foods. Foods that are particularly high in potassium, such as leafy greens, potatoes, sweet potatoes, bananas, avocados, milk, yogurt, tuna, salmon, beans, coconut water, nuts, and seeds. However, a high potassium intake may be harmful to people with kidney disease, so talk with your doctor before increasing your potassium intake. Tip number 4. Review your caffeine intake. In fact, people who drink caffeinated coffee or tea tend to have a lower risk of heart disease, including high blood pressure, than those who do not drink it. However, caffeine can cause a short-term spike in blood pressure. So if you already have high blood pressure, consider to cut back on caffeine. Tip number 5. Drink less alcohol. Drinking alcohol can raise blood pressure and increase the risk of several chronic health conditions, including high blood pressure. Men should stick with no more than 2 drinks a day. Women should keep it at 1. One drink looks like 12 ounces of beer, 4 ounces of wine, 1.5 ounces of 80 proof spirits, or 1 ounce of 100 proof spirits. Red wine has been linked to heart health, but you should still limit the amount you drink. Tip number 6. Learn to manage stress. Stress is a key driver of high blood pressure. When you're chronically stressed, your body is in a constant fight or flight mode. On a physical level, that means a faster heart rate and constricted blood vessels. When you experience stress, you might also be more likely to engage in other behaviors that can adversely affect blood pressure, such as drinking alcohol or eating processed foods. Ways of relieving stress depend on the individual, but can include practicing deep breathing, taking a walk, reading a book, listening to calming music, meditation, and work less. Tip number 7. Lose weight. In people with overweight, losing weight can make a big difference to heart health. According to a study, losing 5% of your body weight could significantly lower high blood pressure. The effect is even greater when weight loss is paired with exercise. Losing weight can help your blood vessels do a better job of expanding and contracting, making it easier for the left ventricle of the heart to pump blood. The 3 key ways of doing this are: move more, eat less, and eat healthily. Tip number 8. Quit or avoid smoking. Smoking can affect your all-around health, including your blood pressure. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation, and narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels, even if you're around secondhand smoke. Tip number 9. Cut added sugar and refined carbs. In one study, increased consumption of sugar-sweetened beverages was linked to higher blood pressure levels. And it's not just sugar, all refined carbs, such as the kind found in white flour and white rice, convert rapidly to sugar in your bloodstream and could cause problems. Some studies have shown that low-carb diets may also help reduce blood pressure, along with several other risk factors for heart disease. Tip number 10. Eat berries. Berries are full of more than just juicy flavor. They're also packed with polyphenol, natural plant compounds that are good for your heart. Polyphenol can reduce the risk of stroke, heart conditions, and diabetes and improve blood pressure, insulin resistance, and systemic inflammation. People consuming berries and polyphenol-rich foods experienced improved markers of heart disease risk. Tip number 11. Eat calcium-rich foods. People with low calcium intake often have high blood pressure. While calcium supplements haven't been conclusively shown to lower blood pressure, calcium-rich diets do seem to be linked to healthful levels. In addition to dairy, you can get calcium from collard greens and other leafy greens, beans, sardines, seafood, tofu, orange juice, nuts, and seeds. Tip number 12. Limit processed food. Processed foods are often high in salt, added sugar, and unhealthy fats. They may lead to weight gain. All these factors can contribute high blood pressure. Examples of processed food include processed meats, many fast or fried foods, and processed snacks. Eating less processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood pressure. Tip number 13. Eat foods rich in magnesium or take magnesium supplements. Magnesium is an important mineral that helps blood vessels relax. While magnesium deficiency is pretty rare, many people don't get enough magnesium in their diet. Some studies have suggested that getting too little magnesium is linked with high blood pressure. Still, you can ensure that you're meeting your needs by enjoying a variety of magnesium-rich foods, including vegetables, dairy products, legumes, chicken, meat, and whole grains. Tip number 14. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract may help lower blood pressure. Studies found that for people with high blood pressure, garlic supplements reduce their systolic blood pressure by up to about 5 millimeters of mercury, and their diastolic blood pressure by up to 2.5 millimeters of mercury. If you want to go for any supplements, always check with a doctor. They may worsen other conditions or interact with existing drugs. There you have it, 14 effective ways to lower blood pressure naturally without medicine. I hope you liked the tips that were shared in the video, and hopefully, you're now one step closer to improving your blood pressure and your overall health. Do you have anything to add? Please leave us a comment below. Thanks for watching. Hope you have a healthy and happy day.